Everyone, it's Tremia, and it's been a while, and I'm trying my hardest to keep up on these vlogs, and the time just flies by. And believe me, it's not because I'm having fun, just dealing with a lot of, medical stuff and all that kind of things. I did have my surgery for the removal of the tumor on my back. That was done on the 9th, and so I'm about 9 days out, and everything went very well with the surgery. He got the tumor completely out and got clean margins, meaning that there wasn't any kind of bad cells outside of the tumor. He took out the tumor and cut extra into my muscle, took out muscle, just in case there was any kind of bad cells. But they all came back clean, so everything's benign and in good order. It is a fibromatosis instead of a leiomyoma, and a fibromatosis has a chance of reoccurring, and it's a pretty high percentage rate. But it recurs in the same spot. It doesn't metastasize to a different spot. So we will have to keep watch on it, and every 3 months I have to go in and get an MRI, and they'll check for the tumor again, and if it comes back at that point, it will be surgery and chemotherapy, radiation, that kind of thing. So I'm standing on the 17% that tumor is not coming back, that it's gone. One thing crazy did happen during before the surgery, actually, and I wish it not even on my worst enemy. The anesthesiologists, they come in and they see you before the surgery and explain what they're going to do. And Dwayne told the gentleman, well, she has trouble being sedated, and of course it's not sedation, it's general anesthesia. And he goes, so she will be out. First off, we do this, and this in this order, and I would be intubated, and a ventilator will be breathing for me. And so he goes, we're going down to the operating room now. So he gave me a shot of Versed there in the pre-op, and so he goes, that'll calm you down on the way back. But of course Versed does not work on me, and that's what Dwayne was trying to explain to the gentleman. We get down there, and he said it's time for hugs and kisses and goodbyes, so we hugged and we kissed, and they took me directly into the operating room. And at this time I'm still on my bed, and Dwayne told them that they said they're going to transfer me over from lying on my back to being on my belly for the surgery. And Dwayne said, you have to be careful with her, because I'm having trouble breathing, because she, has severe osteoporosis, and her bones are still brittle, and you can break them. And he says, don't worry. Thank you for telling me, and we will take every care and precaution. And, she's in good hands. So we get down there, and I'm on my table, and they haven't transferred me over. The girl goes to, just put the oxygen mask on me, and it stunk. So I kind of pushed it away. And I said, are you already starting? Because he had told us that the gas is so pungent that if you were awake, when you smelled it, you would immediately vomit. And so the gas is one of the last things they give you after you're totally asleep and the airway's in, and so you're not smelling that. And he goes, all you're smelling is that the tubing of that mask is just really strong smell, which, you know, I know the tubing does have a smell. So I said, okay. And then he goes, don't worry, I'll tell you when we're going to start. And then he goes, okay, we're going to start. And I thought, oh, okay, so I'm going to kind of just drift off to my happy place. And all of a sudden, I am just totally paralyzed. I cannot move. I cannot breathe. My lungs are paralyzed. I cannot do anything at all. And I'm suffocating. And I'm trying to yell. I'm trying to scream. I hear them talking and laughing and, you know, preparing me for the surgery. You know, getting things ready. And I know I'm dying. And in my head, that he had told us before how he tells if his patients are completely sedated is he'll tickle their eyelashes, and if you squint your eyes or flutter, he knows he's got to go a little bit deeper. So I'm even trying to make my eyelashes move, but I am totally paralyzed. And the paralytic that he gives you, it was like number 4. It was like the 4th thing he does before, because they do that, then you're paralyzed. So your vocal cords, they can intubate you, and you're not kicking and screaming, even though you're sedate, you know, asleep. But he gave it to me first, which had to be totally by accident. And I'm to the point, I'm screaming in my heart for Dwayne. It's just like, God, please let Dwayne hear that I'm in trouble, and just let him run through those doors, you know, and just save me. And I know I'm turning blue. I know I'm turning blue, and the oxygen that's in my blood is almost gone, and I'm fading away. And I thought, God, after all I've been through, and this is the way I'm going to die, and that they're going to have to go out there and tell my husband that I died before I even got on the operating room table. And then all of a sudden I hear a man yell. I don't know if it was the surgeon walking in or the anesthesiologist. They could see me, and I know I'm blue. And they go, she is paralyzed and she's not breathing, get her on the table. And they flip me over like a pancake. And that's the last thing I remember. So the last thing I was thinking is that, you know, I have like 2 seconds and I'm dead. Most terrifying, most horrifying experience. And this could have been worse. He could have not realized that he hadn't given me this sleeping medicine. He could have just paralyzed me, intubated me, and my mind still could have been awake. And also he could have not have given me the analgesic, which causes no pain, for you not to feel the pain. He could have not realized he hadn't done those things, and I could have been paralyzed, intubated, wide awake, feeling every bit of pain of the operation. And you know, those are the horror stories you hear on TV. I mean, that's even worse than what I went through. And what I went through was totally terrifying. And I didn't remember that until we got home. So we haven't had a chance to talk to the doctor or the anesthesiologist yet to see. I don't know if they even had to resuscitate me. I don't know if they had to call a code blue. I don't know if they're required to tell you those things. And I know we will be requesting a copy of the operation report and all of that to see exactly what's reported and what's not. Hopefully they are truthful. I know this isn't something I dreamed up. I know it truly happened. So, with all this horrifying experience, as far as the surgery, I'm doing good. The muscle they sewed up with sutures and stitches. My skin, they used the Dermabond and glued it. And it's doing well. There's no infection. There's still quite a bit of redness. But a nurse comes over every day and does my wound care, except on the weekend. So Dwayne did it this weekend. And so I'm just really sore, and it hurts to be in any one position just too long, and it's because of that muscle. Muscles are painful to be, operated on, let alone them taking out a lot of it. So that's where we're at. And tomorrow I go and get my IVIG, so I'll be gone all day for that. But I hope none of you have had that experience. Let me know if you have and what become of it. And I'm having trouble breathing, so I'm gonna call it. I don't know how long this has been going, how long the video is, but I'll see you guys in the next video.